Nytol Quickcaps contains diphenhydramine, an antihistamine used to relieve symptoms of allergy, hay fever, and the common cold. These symptoms include rash, itching, watery eyes, itchy eyes/nose/throat, cough, runny nose, and sneezing. It is also used to prevent and treat nausea, vomiting and dizziness caused by motion sickness. Diphenhydramine can also be used to help you relax and fall asleep. This medication works by blocking a certain natural substance, histamine, that your body makes during an allergic reaction. Its drying effects on such symptoms as watery eyes and runny nose are caused by blocking another natural substance made by your body, acetylcholine. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products, such as long-acting tablets/capsules, are not recommended for use in children younger than 12 years. Ask your doctor or pharmacist for more details about using your product safely. Nytol Quickcaps do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. It is important not to use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms such as drinking enough fluids, using a humidifier or saline nose drop/spray. As for the optimal timing, it is best to take Nytol Quickcaps as directed by your doctor or pharmacist. When taking Nytol Quickcaps, make sure to follow the directions on the product package or as prescribed by your doctor. You can take the tablet, capsule, or liquid form with or without food, and be sure to use a special measuring device/spoon for liquid forms. If you have a single-dose form, you do not need to measure the dose. For the rapidly dissolving tablet or strip, let it dissolve on your tongue and then swallow it, with or without water. Chewable tablets should be thoroughly chewed before swallowing. The dosage will depend on your age, medical condition, and how you respond to treatment. Different brands and forms of diphenhydramine may have different dosing instructions, so be sure to read them carefully. Do not increase your dose or take this medication more often than directed. If you're taking Nytol Quickcaps for motion sickness, take your dose 30 minutes before starting the activity. If you're taking it to help you sleep, take your dose about 30 minutes before bedtime. If you continue to have difficulty sleeping for longer than 2 weeks, contact your doctor. Remember to tell your doctor if your condition does not improve or if it worsens. Some common side effects of Nytol Quickcaps may include drowsiness, dizziness, constipation, stomach upset, blurred vision, or dry mouth/nose/throat. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as changes in mental/mood, like restlessness or confusion, difficulty urinating, or a fast/irregular heartbeat. Seek medical help right away if you have any very serious side effects, including seizures. While allergic reactions to this drug are rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. Remember to always consult your doctor for medical advice about side effects and report any side effects to the appropriate regulatory authority in your country. Before taking Nytol Quickcaps, it's important to talk to your doctor or pharmacist if you have any allergies to diphenhydramine or dimenhydrinate. This product may also contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. In terms of medical history, it's important to inform your doctor or pharmacist if you have breathing problems, high pressure in the eye, heart problems, high blood pressure, liver disease, seizures, stomach or intestine problems, overactive thyroid, or difficulty urinating. It's important to note that Nytol Quickcaps can cause dizziness, drowsiness, or blurred vision. It's advised to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. It's also recommended to avoid alcohol and marijuana while taking this medication. For individuals with diabetes, liver disease, phenylketonuria, or any other condition that requires limiting or avoiding certain substances in your diet, it's important to speak with your doctor or pharmacist before using this product. This medication can also affect children and older adults differently. In children, it may cause excitement instead of drowsiness, and in older adults, it may increase the risk of falling due to drowsiness, dizziness, confusion, constipation, or trouble urinating. For pregnant individuals, it's important to use this medication only when clearly needed and to discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication while breastfeeding. It's important to be aware of any potential drug interactions that may occur with Nytol Quickcaps. This includes antihistamines applied to the skin, opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, and other antihistamines. It's important to inform your doctor or pharmacist of all the products you use, including prescription/non-prescription drugs and herbal products. Additionally, be mindful of the ingredients in other medications, such as allergy or cough and cold products, as they may also cause drowsiness. It's also important to note that this medication may interfere with certain lab tests, so be sure to inform lab personnel and your doctors if you are using Nytol Quickcaps. As always, consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Nytol Quickcaps and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to call for emergency medical assistance right away. In the US, you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. Symptoms of an overdose may include severe drowsiness, seizures, and dilated pupils. In children, you may notice changes in their mental state or mood, such as restlessness, irritability, or hallucinations, before they become drowsy. It's important to seek help immediately if you suspect an overdose has occurred. Make sure to keep all your medical and lab appointments, as this will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to follow their guidance closely. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. Make sure to store Nytol Quickcaps at room temperature, away from moisture and light. It's important not to store them in the bathroom and to avoid freezing the liquid forms of this medication. Keep all medications out of reach of children and pets. Don't flush Nytol Quickcaps down the toilet or pour them into a drain unless specifically instructed to do so. When it's expired or no longer needed, make sure to properly discard this product. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.